Antibody deficiencies encompass the most common primary immunodeficiency diseases. B cells differentiate into plasma cells, and the plasma cells are the ones that produce antibodies or immunoglobulins, such as immunoglobulin G, IgG, immunoglobulin A, and immunoglobulin M. So antibodies have a few functions. Opsonization, which is essentially coating of a bacteria, for example, which will help facilitate phagocytosis. Bacteria opsonized by antibodies are phagocytized 50-fold more efficiently by neutrophils. The other function of antibodies are to activate complement proteins, which are circulating proteins important in the immune response. Deficiencies of antibodies result in recurrent infections, especially recurrent encapsulated bacterial sinopulmonary infections. So infections involving the sinuses as well as the respiratory tract. Examples of antibody deficiency diseases include when you have absent B cells, such as in X-linked A gamma globulinemia, or where you have impaired B cells to begin with, such as in common variable immune deficiency, or where you have selective antibody deficiencies with abnormalities in shape and structure, such as in IgA deficiency. For suspected antibody immunodeficiency diseases, it's important to measure immunoglobulins in serum. So you check serum IgG, IgA, IgM, and IgG subclasses. It's also important to check for lymphocyte count and subsets. T cells are required for B cell activation normally. So a low T cell count is suggestive of combined immunodeficiency diseases. Absent B cells may indicate X-linked A gamma globulinemia. It's important to exclude secondary causes of low immunoglobulins because drugs can cause this. Multiple myeloma, you can have loss of immunoglobulins in urine, as well as gastrointestinal losses. There is a good investigation to evaluate for antibody deficiencies called functional antibodies. This test is called the pre and post vaccination test. So let's learn a bit more about this. Antibodies represent an important part of our immune memory. When we vaccinate, the antigens that we give are picked up by antigen-presenting cells, which essentially will stimulate production of antibodies to that specific antigen. So our body is prepared and primed towards that antigen. And so we can test for antibody deficiencies by performing the pre and post vaccination test. This test is where one receives a vaccination against streptococcal pneumoniae, for example. And so they will receive streptococcal pneumoniae antigens in their body. And you expect to see an antibody response against the streptococcal antigen that was given. If there is no antibody response mounted, this means that there is deficiency in antibody production of whatever cause. So let's take a look at the three major predominant antibody deficiency diseases. The first is the common variable immune deficiency. Common variable immune deficiency, or CVID, is the most common primary immunodeficiency worldwide, characterized by impaired B cell differentiation with defective immunoglobulin production. It is the most prevalent form of severe antibody deficiency affecting both children and adults. Variable refers to the heterogeneous clinical manifestation of this disorder, which includes recurrent sinopulmonary infections and diarrhea, heightened susceptibility to lymphoma, as well as heightened susceptibility to autoimmune disorders such as inflammatory bowel disease. It is a diagnosis of exclusion. You get absence of antibody production in response to vaccination. Treatment includes immunoglobulin replacement, and immunization with inactive vaccines. The second major predominant antibody deficiency disease is selective IgA deficiency. IgA is important in the mucosal immunity. When you have deficiency in IgA, there's increased risk of sinopulmonary infections. And less commonly, you can get diarrhea from an infective cause as well. These patients have undetectable to low IgA levels in serum with normal IgG and IgM. Anaphylaxis to blood products may occur because of the presence of anti-IgA antibodies in the people who have IgA deficiency. The third antibody deficiency is problems with making B cells in the first place, and these include X-linked and autosomal recessive A-gamma globulinemia. These conditions are characterized by genetic defects that essentially result in complete arrest of B cells, so you don't produce B cells. In summary, these three major predominant antibody deficiencies are characterized by deficiencies in either B cells and or their antibodies. And this will result in the clinical presentation of recurrent encapsulated bacteria sinopulmonary infections. Encapsulated bacteria of note include Streptococcus pneumoniae, Haemophilus influenza, Neisseria meningitidis, and Salmonella typhi. You can also have increased risk of respiratory viral infections as well. Diarrhea can also be seen with pathogens such as norovirus and Campylobacter as the most common causative agents. So in summary, antibody deficiencies, think recurrent encapsulated bacterial sinopulmonary infections. Thank you for watching.